Welcome everyone. This is Marie Waite. I am here with Dr. D, our dentist in Temecula Valley with Choice Dental Temecula. Dr. D, welcome.
Thank you very much. Yes.
So Dr. D, tell us about you. I mean, I'm so excited because I know you're helping me with my own dental, needs. And so tell us about you.
Yes, I graduated from USC Dental School in 1993. So I've been in business for a while. I've basically taken a lot of continuing education courses and different aspects of dentistry. So we are actually serving people, Marietta, Temecula, and surrounding. I started here about 6 years ago. Okay. But I've been in LA area, in Las Vegas, and now back home to California, and I'm intending to stay in this area forever. So,
wow.
The aspects of dentistry that we are taking care of. So we try to be one-stop shop with one dentist rather than, some offices. There's one location, but you have different dentists to deal with different specialties. But we try to minimize very much the sending the patients out of the office for convenience, and it takes a while to get used to a dentist, and then you have to go for your specialty work to another dentist, get to know them, and all that. So basically, I do general dentistry, like doing regular fillings and tooth color fillings, all porcelain crowns and cosmetic dentistry, full mouth reconstruction, things like that. Also taking care of if you have joint the TMJ problems, you can have a look at it. Most likely we can help you. Dental sleep apnea is another aspect that we are good at. So, and dental implants, of course. Dental implants, we do surgery part and the restoration part. Okay. So, as I said, you don't have to go somewhere else. So these are basically the overview of the office right now.
Okay, that is very interesting, Dr. D, because I know that I've met some dentists where I can only do cleaning. And then if I have to do some implants or anything that is advanced, I have to go to another dentist for that. So with you, you're able to serve people from whatever the basic, standard of dental services to the advanced too.
Right.
Wow. Right. So how is that different from everybody else? I mean, is it because you've taken all the educational, support for all of that? I mean, what was it? What was your background in terms of the educational on it?
Well, when I got into dentistry, I just didn't want to be like, do one thing. I wanted to provide provide most of the services that are available and I can do. And for us dentists, like any other subject, other professions, there are continuing education provided, and it's up to us to educate ourselves and go learn different aspects of dentistry. And there is no limit what we can do, but of course you have to become knowledgeable, and your work has to be better, or if the same or better than the specialists to be able to perform. So it's up to us to go educate ourselves. So I've spent many hours, of course financially spend a lot, to learn about those things so I can provide for our family of dentists. So we call them guests in our office, so our guests of the office. So I mean, it's for the patients or the guests' convenience too, to be one location, trust one doctor, and be friendly, be as a friend and treat them as a family. So that's our goal in Choice Dental. So.
Okay, so let me understand this, Dr. D. So how many years do you go for the basic dentistry business?
Generally, after high school, you need a bachelor degree. There's some schools that require 2 years, but almost all of them 4 years. Okay. And after you graduate, then you go 4 more years of dental school. So, and then after you graduate, then you have an option to become specialist, or you can go ahead and seriously educate yourself like a specialist, different areas, so you can take care of other things. So,
So is that, so
it was
hold on. So you said 4 years of college, bachelor's,
4 years,
and then 4 years, another 4 years?
another 4 years of dental school. So that's
So
8 years.
so
Yes.
that's 8 years. And then on the continuing education, how long is that?
Continuing education, can go forever, that depending what you want to do. I spend many hours and travel time and all that to learn about, let's say, braces, orthodontics, let's say about dental implants, cosmetic dentistry. So if you add it all up, that's another, I don't know, maybe another 15 more years, 10 more years, 15 years, adding up the hours that's spent. So it's all on dedication and interest. So
it's just been continuing for you. You just keep, yeah, you just keep educating yourself on everything that people would need.
That's why it's called continuing education until you die.
Okay, well, that's good because you're very passionate about being a dentist. So,
Yes.
and I truly appreciate you because, again, I realized that you could do anything from cleaning all the way down to putting an implant or doing bone marrow. And it's just amazing that you can cover all of that in your service.
And
So,
yeah, and also it has to be to this standard or above this standard, as I said, of the specialist. Otherwise, you'll be all scrutinized. So I'll try to learn it, more than a specialist per se, because specialists too, they need to go do their continuing education. So if there are available, you become a specialist, then you have to go take more continuing education. I'm taking what they take as a continuing education. So that's kind of adding up to the knowledge.
Okay. So let me ask you, Dr. D, what is your favorite part of your work?
Well, the favorite part is truly not getting there, seeing a patient or a guest, coming there. They have issues, problems, whether it could be they want to enhance their smile, they can go get a job, or they just want to make themselves look good, or they have pain, you get them out of pain. The medical part of it, take care of the disease in the mouth. So just being involved with, educating the guests, the patients, also taking care of their problems. Maybe they're losing teeth, they want to be able to chew so they have a better health. So as a whole, helping that person or group of person, the family, the kids and all that, to be able to help them to have better health. The other day, we had a patient who the teeth are broken down. So we started doing units of veneers and crowns, and it was almost in tears, a big guy, that looked, and the temporary, then we put a permanent on. So it's just nice to see, what you get out of what you spend, truly, after spending all this continuing education, the time spent is not per se monetary wise, but what you put in and what you get as a, when you help the people, the guests that come to the office.
Okay. And you treat anybody from young age to,
Yes.
the senior age.
Right.
Yeah.
So,
Okay.
yeah. So, I mean, if a kid comes in and, very young, you're able to, and that's a good thing about it. If we have to refer them where they're not cooperative, we can't deal with it, then we can refer, yes, but we'll try our best to, accommodate everybody, yes.
Okay, so one thing about braces, because I did have my kids have braces when they were young. Yes. One thing that I've learned is that, when you put braces, there is something that has to be done correctly in order to keep those teeth straight. But I found out that, a dentist might not understand that part to where, another dentist can say, well, that was not done correctly. So I am trying to understand what was the problem in putting in braces into a young kid. I mean, what is the technical experience that's needed to do that?
Well, that's where you go take continuing education courses. And, as I said, like an orthodontist also go take continuing education courses to better themselves or to learn more advanced stuff. So that's why, you go and educate yourself, I'll go educate myself. So you have to know, there are certain things where you're biting, sometimes could prevent, you try and put forces to take the teeth certain position, but the bite doesn't allow it. So you need to adjust the bite in order for that tooth to go to that place.
Okay.
So, then back and forth can damage the tooth. So having a knowledge of we call occlusion, having knowledge of all aspects of the mouth, the teeth, can help doing certain things, whether it's orthodontics, implants. So you need to know, the more knowledge you have, the better, and then you can implement it to the patient.
I see what you're saying. So if a dentist is specialized on braces, he needs to know other areas of the mouth,
Right.
services that would make it successful. So it's not
Right.
just being specialized as an orthodontist, you also really need to understand the other areas
Right.
of dentistry. Okay, so that's what I see different with you, because what I notice is when you talk about, when I ask you about a specific problem, you actually know the other areas that would affect it. And that's what I was very impressed about your knowledge, Dr. D. And that's what people need to know about you, because of your extended education on dentistry. They need to know that that is very important for a dentist to have, aside from being a specialist only.
Right.
Okay.
Yeah, I mean, as I say, specialists go take continuing education courses. So we come out of school, a certain aspect, and we have to educate ourselves. So they also need to take other aspects of dentistry, whereas it's occlusion, the bite forces, things like that. So
yeah.
Yeah.
So not just one thing, it has to be
Yes.
almost everything. Okay, that's what
Yes.
and I was really very impressed again with your
Thank-
extended education, and I'm thankful for all your services that you do for our community. And also being a Fire Up Connect member, I am very honored to let people know about you. And again, thank you so much. Now, your office is in Temecula, am I right?
Yes,
Okay.
our office in Temecula, 29645 Rancho California Road, number
Okay.
126. Now we may be relocating to Murrieta, but we'll let everybody know. But right now, yes, we are there.
Okay, so but if they wanted to just reach out to you, Dr. Sassan, and I mean Dr. D, which is what
Yeah,
what would be the best way to contact you if they just have a question?
Well, there are two ways. If you call the office, you can call the office. Then, if it's after hours, for emergency, my cell phone number is also placed there. The best is to call the office first.
And what is that? What's the
It's
number?
the 951-676-4556.
Okay. And they can, and
And
what hours are you open?
we are open Monday through Thursday, 9 to 6. Thursdays, 9 to 3. And Saturdays by appointment. And those hours right now, because COVID and all that, they may change, but that's the hours we have right now.
Okay. And then, I know that it was so easy to reach you also. I mean, when a patient is going through problems after being treated, I mean, they can easily access you, which is so nice
Yes.
to have from a dentist,
Yes.
especially
Yeah,
when you're so much pain and you're worried about what's going on.
Right. Yeah, I mean, they're always welcome. If they call is after hour, I'm not there. There should be a emergency number. As I said, that's my cell phone number. I'm accessible anytime they can call. That's
Yes.
fine.
I'm very much aware of that, Dr. D. And it's so nice to have someone like that, because, when you're in pain, I mean, it's like, you are
Yes,
totally
of course.
dependent on your
Yes.
dentist.
Right. Yes.
Okay. Well, I thank you so much for your
And-
time, Dr. D. I
thank
think
you.
this is amazing. For all of you out there, please make sure to share this video. Reach out to Dr. D for any kind of dental work that you need, because he is so easy to talk to, very personable. And again, and if you just wanted to learn about dentistry, I'm definitely sure that Dr. D wouldn't mind being asked
Yes.
those questions. So anyway,
Yes.
thank you so much, Dr. D,
All right.
and thank you everyone.
Thank you. Thank you for your time. Thanks. Bye-bye.
Yes, and have an amazing day, you guys. And I'll bring some more experts to you more for additional information that will help your business and your life. Okay? Have an amazing day, you guys. Bye-bye.